And action. Pam had a question about medical marijuana. I'm going to try to make this concise. Cannabis can be used as medicine. There's more information now that it's been approved for compassionate use throughout many different states. You'll see the data roll out. There's old information that proves most of the cells in the body do have receptors for the endogenous cannabinoids that we make. So we do make these things that resemble the compounds that you find in the marijuana plant. The two compounds that are found and made throughout the body itself are anandamide and something called 2-AG. Those two chemicals are produced by our cells, and they stimulate some cells in the brain that have CB1 receptors and some cells in the body, mostly immune system cells, that have CB2 receptors. So that's established already. And we know that if you do stimulate the cells in the brain or cells in the body, those cells work better. So work better to function, work better to fight infection, work better to calm anxiety. The cool thing is that you can also get that in the plant or the phytocannabinoids. So the plants that we have out there are grown and distributed at dispensaries. So there are businesses that make and cultivate marijuana. And the cannabis plant can be broken down into its ratios of THC, tetrahydrocannabinol, and CBD, cannabidiol. And between the two things, THC and CBD, those are the two biggest components that are found in the plants. And when you have a ratio of CBD and THC, you can kind of adjust the ratio and get what you want. People that have anxiety, people that have insomnia, people that have worry or post-traumatic stress disorder do better with high THC levels. People with inflammation, fibromyalgia, Hashimoto's thyroiditis, lupus, MS, they do better with high CBD ratios. I would like to have my patients always, after they get approved, come back to me so we can go milligram by milligram dose and ratio changes depending on their symptoms, depending on the disease, depending on their side effects to those things, the medical marijuana they get. And the marijuana that they get can be in smoked form, vaped form, liquid form, oral form, even topical form. So it really is a wide variety of what to do. If you get certified, then you go to the dispensaries. You'll have people that will be able to tell you about big gram doses. And I think that's good as a salesman to get the most popular brands, but you'll see when, especially if I'm trying to get a high CBD and low THC concentration, they don't sell as much because people want more of the THC part. And it really takes the work of your coach, in addition to the dispensary, in addition to the patient giving me feedback on side effects, to figure out what's good for you. And sometimes you will have a problem with sleep and a problem with inflammation, so it might be a management of when to do the timing, when to use the oral, how to use combinations of the two. So really it's a touch and go. It's a design in progress kind of approach to figuring out what works best. That's why it's always important to touch base with your doctor. In New York, in the state of New York, anybody that gets approved for the card actually can only get to the dispensary after having a prescription from a doctor. So I think it's great. In Illinois, you just get your card and that's it. But I usually have my patients come back to me for fine tuning. Again, milligram by milligram dosing and ratio adjustments. So that's just a good pointer. Any of my patients, if you're going to get your own card, please come back and talk to me as far as which dispensary you go to and how to adjust it over the course of time. It also has interactions with medicines too. Very small, but since we know that studies using dronabinol, which is the prescription form of THC, used or approved back in the 80s, it was the only one that was approved for HIV wasting and chemotherapy-induced nausea, vomiting. And so the FDA has actually approved this stuff, but yet it's still considered a Schedule I drug, which means high potential for abuse and no medicinal use, which doesn't make sense. So the FDA approved it for a medicine, but they still have it as a illegal substance, like heroin and LSD. Politics. But just realize this. you'll see more information forthcoming over the next decade, most likely because people are getting out there and getting their own treatment. But again, realize this, even if you get the card, there's all that fine tuning I just mentioned, but you work with your doc to possibly wean up on the cannabinoid stuff, wean down on the prescription medicine stuff while making those lifestyle changes. Just because we get approved for the disease processes, I think it's 39 at this point in Illinois, because you get approved doesn't mean you're going to take care of yourself on your own. You still have to have a lifestyle change with proper nutrition. You still have to have lifestyle change with some kind of activity. Even if you're fibromyalgia, spastic multiple sclerosis, and you get controlled, or Parkinson's and you get controlled, you still have to maintain good nutrition, good activity, and some form of mindful practice. If you don't, and you just rely on the medical marijuana, you'll be cranking up the dose of the medical marijuana, you eventually have side effects. The side effects are there, but they, just like any other medicine, have to be controlled. That's why it's important to always follow up. So always just remember it's another possible use. It has to be kind of throttled with your coach. Your lifestyle still has to be pushed as best as possible to being healthy and being bulletproof, and possibly getting off the medical marijuana or getting off your medicines. I really think that if you can maintain a healthy life, a healthy lifestyle change, anti-inflammatory lifestyle, you should be able to get off medicines. You should be able to tone down or get off your herbs. Might even be able to get off medical marijuana. So it's always a hope. That's the usual. So the short-term goal is control symptoms and suffering. The long-term goal is to be happy, not use anything if possible, and just maintain with those basics. So Pam, I hope this helps you figure out whether this might be the right thing for you. But if you work So Pam, I hope this helps you figure out if this might be the right thing for you. But even if we don't go down that route, there's always other things. Sometimes I just did a video on low dose. There are also other things. I just did a video on low dose naltrexone. I just did a video on low dose naltrexone. There's medical marijuana. There's acupuncture. There's mind-body medicine. There's other things that we can do to manifest health again.